I'm Blessing Moyana, BCN, BSHN student, group 36, year 3, semester 2, PIN number, it's 2364889U. I'm doing my occupational health practical assessment. Introduction. I'm a community health nurse working at Shalani District Hospital. So I chose the Family Child Health Department, and the Family Child Health Department at Shalani District Hospital manages a population of 17,331 people and 520 under ones. And also it covers two wards, that is Ward 6 and Ward 7. It uses 5 rooms. It opens from Monday to Friday. It is managed by one doctor daily and he has 6 nurses and one nurse aide and one general hand. The department provides a comprehensive package which includes ANC services, postnatal services, immunization services, HIV services, and testing and counseling services. Hazards identified during the visit. Number 1, there was congestion and shortage of working rooms leading to nosocomial infection. Number 2, lack of proper safety boxes, whereby the department was using cardboard boxes, and there was also a hazard of improper disposal of sharps. Number 3, lack of privacy due to shortage of infrastructures on the clients they were seeing. Risks associated with the congestion and shortage of workplace. Number 1, overcrowding exposes patients to poor ventilation and airborne infections, and leading to conditions like tuberculosis, cough, and also respiratory tract infections such as COVID spread. And also congestion also leads to medication error due to fatigue of nurses. It also exposes staff to burnout and violence due to pressure of patients. It also exposes to occupational risks such as delay in care, so the waiting time for the patients will be more than what is expected, which is less than 2 hours. Inadequate working rooms and poor maintenance, leading to poor quality, whereby some of the clients will not be able to explain themselves out. Lack of proper safety boxes in FCH department leads to needle prick injuries, which exposes to blood-borne diseases such as HIV and hepatitis, and also exposes to environmental hazards and non-compliance regulation. And it also exposes to the pricking of clients. Lack of privacy due to shortage of infrastructures exposes the patient to distrusting of healthcare providers, hindering treatment and compromising the patient outcomes. And also leads to unauthorized access to sensitive patient information, leading to discrimination and penalties to the nurses. Solutions. On the environment, there is need to improve the infrastructure by borrowing the moving cabins so that they can use as extra room for other care for patients to reduce infection. And also the other solution, that is providing education on infection control to staff and also on the workplace safety and emergency response to staff, so that they will be able to manage in case of emergency and overcrowding of patients. Administration department to procure more safety boxes, and the health workers to be educated on proper disposal and handling of sharps, and also conducting regular inspections. In conclusion, to relieve congestion, there is also need of the administrative staff to borrow cabins, so that they can put some cabins, 8 cabins, so that the patients will be seen on spacious areas to prevent airborne infections. And also the procurement department to procure more safety boxes, so that the nurses will not use improvised card boxes for safety boxes. And also there is also need to enhance on proper disposal of sharps to the nurses, so that they just don't throw sharps anywhere, even if they are having much pressure of patients. The recommendations. I recommend the administrative department to procure more cabins, so that they can put them at the FCH department to promote privacy and safety of patients. And also, I recommend the procurement department to procure more safety boxes, so that the nurses won't improvise with card boxes, which can lead to some injuries. Also, the procure department to buy some screens and also locks, so that they will be able to lock in patients' documents. Thank you.